All right, hello and welcome to Tackling the States of Abortion Data in the US. We're so honored to be here today with you, with learners and leaders from around the country. My name is Tracy Flood. I'm the president and co-founder of the BroadStreet Institute. And joining me today are Sarwat and Brenna. We'll be sharing a little bit more information, more about ourselves in just a little bit. We also want to give a shout out to the writers and the leaders of this initiative, Shifa and Devin, who couldn't be here today, but definitely helped to prepare not only the data set, but also this presentation. All right, we're going to start really by sharing our goals. What was the reason for bringing everyone together? We really want to give some background also on who we are, who the speakers are today, and who's the BroadStreet Institute and the Community Data Internship. After that, we're going to talk about the Abortion Data Initiative, why we started it, why are we doing it, what we learned from taking stock of available data, and what we found out about some challenges. Also to share our progress and our timeline, our past timeline, and also our future plans. So there's going to be plenty of time for discussion, and really we want to hear from everybody and to have a nice chat afterwards. All right, so here at BroadStreet, we really do believe that good data can heal the world. Our mission at BroadStreet is to assemble and share good data for those working to improve health in their communities. And we do this by lifting up the next generation of leaders. So we believe that data is part of the conversation, advancing those discussions and how to bridge divides and solving this generation's greatest challenges. So of course, good data and local data is really only part of the conversation. What's most useful is when people can use it. So that's the goal of why we're here today, to build connections and partnerships with community change makers and key stakeholders as we build this data project. We know that we face challenges as we dive into the data. We know that we have a lot to learn, and we respect the experts who are already working in the field. So definitely we welcome everyone to this conversation. All right, a little bit about us. So who are these people talking to you today? I'm going to hand it over to Brenna.
Hi, everyone. My name is Brenna. I'm from the Twin Cities area of Minnesota. I received my master's degree from the University of Minnesota in maternal and child health with concentrations in epidemiology and sexual health. I am a co-founder of the Abortion Data Initiative that we're going to be talking about for you guys today as well. I'm especially interested in health equity. I have a whole lot of interests in public health in general, but I'm particularly passionate for improving health equity for all, with an emphasis on those who have been historically overlooked. And in my free time, I love to read, play video games, and go hiking. And now I'll let it over to Sarwat so she can introduce herself.
Hi everyone, my name is Sarwat and I'm from the New York City area. I received my bachelor's from NYU in public health and chemistry with minors and concentrations in child adolescent mental health studies and genetics. And I am the director of data operations at BroadStreet, and I've been helping to create the Abortion Data Initiative. My interests in public health include promoting health equity and health literacy, specifically amongst underserved, low socioeconomic status and minority communities. And in my free time, I love to read, I love to eat, I'm an avid foodie, and I'm a big trivia nut. And I will toss it back to Tracy, who will be telling you a little bit more about BroadStreet.
Great, thanks so much. As I mentioned, I'm very proud to be the co-founder and president of the BroadStreet Institute. So what is the BroadStreet Institute, and what specifically is the Community Data Internship? So just a little bit of background here. BroadStreet is a nonprofit that hosts the Community Data Internship. This internship is relatively new. We started in March of 2020 during the pandemic. So at that time, 150 volunteers from around the world came together to create the first ever county level data set on COVID-19. And we've really been leveraging and collecting and assembling data ever since. And we've learned that there's a lot of data out there with a lot of local detail and variation in the city and state data systems. To capture more detail on local trends, we also expanded the COVID-19 data project to include the health equity data collection initiative, and our team also has collected and coded policies on over 8,000 COVID policies, and we've had the earliest vaccine data set. We've now expanded to other fields like child abuse and neglect, mental and behavioral health, and maternal health. And we're also collecting and coding over 3,000 community health needs assessments. So hopefully you can see that we're very into data, and we use qualitative and quantitative techniques to gather it. Our team is honestly so great. At any one time, BroadStreet hosts about 200 volunteers from around the world, with about 50 or so interns on any one data project or initiative. We invest a lot in training to lift up the next generation of data leaders, and in total, over 1,700 interns have been trained to date. This is definitely an internship built for interns by interns, and our team is very diverse. We have many different backgrounds and fields of study here at BroadStreet, and we believe that this diversity makes us stronger. Of course, we all are brought together by the same shared philosophy that better data leads to better health. Diversity makes our world and our nation stronger. This is totally true. Each person and community are unique, and so too are the data collections from each place. So as BroadStreet teams work with data, we try to find the balance between data that are detailed enough to reflect local diversity while also being unified enough to show that big picture. So this big picture is really important. It's a view that empowers effective conversations and strategies and goal setting. And so we always try to find that balance. To talk a little bit more about the context of that sort of exploration with abortion data, I'm going to hand it over to Sarwat and to Brenna.
Hi, everyone. It's me again. So we're going to be starting off with why we started the Abortion Data Collective. Why the heck do we want to do this? This is a question that we've asked ourselves before we started the initiative, and I'm sure it's a question all of you are wondering about as well. The initiative was inspired by the national reproductive health policy changes in the summer of 2022 with the overturning of Roe v. Wade. As we are a data-minded organization, all the news surrounding that topic of abortion made us really curious about conducting a deep dive into what data currently exists in the United States on abortion. We were also concerned about the states implementing stricter policies on abortion, that any available data for those states was vulnerable and at risk of being removed from public access. So we wanted to ensure that the data was archived somewhere in the event that any of that data were removed. So we began to do our deeper dive into the data, and we realized that while there are a few and important and essential abortion data aggregators out there, the majority of local abortion data available to the public was actually not being reported in aggregate. So we recognize this need to create a comprehensive county-level abortion data repository that not only reports county-level totals for all the states in the country, but also reports data by demographics and categorical variables such as race, gestational age, and procedure type, so that we have a detailed, uniformly reported local aggregate abortion data repository available. We believe that by doing this, we'll be producing clean, accessible, readable, and comprehensive abortion data that can not only be used for further research and data projects, but can also be a source for promoting equitable decision-making around discussions on abortion. When we were getting started with our data exploration, we made sure to do our due diligence in understanding what data is already available on this topic so that we could ensure that we were filling a gap in this space with our initiative. In our search, we found a few abortion data aggregators. The BroadStreet Institute is probably the name that comes to mind for most of you when thinking about abortion data and reproductive health policy. They are the primary source for research and policy on abortion in the United States and have laid essential groundwork for establishing comprehensive state-level and worldwide abortion data for decades. The CDC, with whom I'm sure many of us are also familiar with, conducts abortion surveillance through their morbidity and mortality weekly reports, the MMWRs. Data reported to the CDC is voluntary, so states are not required to submit or report abortion data to the CDC. We also found the Robert Johnston Archive, which reports regional county-level total historical data and analyses for the United States and many other countries around the world as well. And finally, we encountered individually reported state-level data sources via each state's public health department's data dashboards. On the state's own data dashboards, we found that these states reported beyond just overall county-level data totals as reported by the other data aggregators that we've seen. They expanded even more into local detailed data, such as demographic totals for each county that were not reported by other data aggregators. And so here's a timeline of what we've done so far. As I mentioned earlier, the overturning of Roe v. Wade in June of 2022 inspired the start of our abortion data initiative. We spent the remainder of that summer, June 2022 and beyond, not only scoping out what abortion data exists out there, which is how we learned about all of the sources on the previous slide, but also by internally archiving all the data that we were finding as a precaution, just in case any of the state level data may become restricted due to policy changes with Roe v. Wade being overturned. Once we had established the basis of our initiative, we spent the remainder of the year of 2022 further planning out the initiative. We're excited to report that we began the initiative and data entry at the start of 2023 and are planning to do our first data release at the end of April 2023. So that's coming up very soon. And now I'm going to hand it off to Sarwat, who will give you a glimpse into the data we found and the challenges and opportunities that came along with it.
Hi again, everyone. So we mentioned earlier that we are planning on producing a comprehensive local abortion data repository. So before we get to that, we want to explain what does abortion data reporting look like nationally on the state and county levels. Short answer, it varies a lot by each state and each county. What you see on the screen here is a screenshot of the data inventory that we established when we were scoping out the data. As you can see, every single state not only varies from each other in what they report, so meaning some states report data by race, some states don't. Some states report by gestational age, some states don't. But they also vary internally within their own state by reporting some of the data on the county level, some of the data on the state level, and some of the data only for certain years. While we were also scoping the data, we also made sure to create an abortion data dictionary, as we noticed that each state also had a different definition of abortion. In terms of what we learned from our initial scope was that every single state in the US reported abortion data using their own definitions, metrics, and formats. It made sense to us why there hasn't been an abortion data repository yet that reports all the local county level abortion data available. However, we at BroadStreet do think that we can create a comprehensive local abortion data repository that does report everything available. How are we going to do that? So we will start our initiative by first compiling all the available data into one uniform format, because currently data is reported across the country using various methods ranging from PDFs to query systems to downloadable spreadsheets. Our reporting format will be spreadsheets and CSV files, as we believe that this is the cleanest way to report the data, as well as the best method for others to be able to download and use the data. And as we are initially compiling this data into one format, we are hoping to gain an even deeper understanding of the data and ultimately aspire to consolidate the data for all variables, counties, and years. We plan to report both the entire spread of data available as is in one uniform format, as well as report the consolidated version of the data. And we also plan to release data every 2 months, starting with data available for the most recent years, as we believe that this data will be the most impactful to be shared first. Ultimately, we do plan to release all the data available, and in doing so, we are hoping to paint an extensive understanding of how abortion patterns have changed over the past several decades. All that being said, to get started, we'll be reporting county-level yearly data for the following metrics in which abortion data is reported, as these are the most commonly reported categorizations reported amongst all the US states. We believe that abortion data being reported uniformly through the lens of these metrics will be critical in understanding abortion from a health equity point of view, but we are aspiring for this repository to be all-inclusive. So if we do find other metrics, we will do our best to report those as well in the same uniform format. In terms of what the rest of the year looks like, we are excited to be sharing our first data release at the end of April 2023. So far, we've spent the year just kind of getting started with the initiative and collecting data for the most recent years. And we plan to consistently publish data every 2 months for the remainder of the initiative. A broader look on what's on the horizon. So as I mentioned, our first data release will be in April 2023. We plan to release our data on GitHub, and we will be sharing more release updates in the upcoming weeks as we get closer to this data release deadline. And you can check out those updates on all of our public platforms. And over the next coming months, we will also continue to surveil existing data sources, as many states have begun reporting data and releasing data for the year of 2022. As data is released, we are immediately internally archiving it first for the purposes of storing any vulnerable at-risk data, and until we are able to release it. And ultimately, we're just really excited to be working on creating a categorically comprehensive abortion data repository, and we hope to engage discussions with key stakeholders to ensure that this data will actively be contributing to equitable research and decision-making in abortion and reproductive health work.
Thank you so much. Thank you, Sarwat, and thank you, Brenna, and thank you to all of our participants here today. If you have any additional questions or want to talk to us a little bit more about this initiative or BroadStreet overall, this is how you can contact me. Feel free to take note of this email address. And I want to thank our funders that fund BroadStreet overall, Catalyze Challenge, the BroadStreet Data Co-op, the Slack Workspace, and of course, it's all made possible thanks to our amazing volunteers. So thank you honestly so much. In these slides, which we can also share, we also have a few resources that are some great links to some of the existing data sets that are out there now. All right, with that, we will open it up to questions.
I think that an interesting question that we've been getting a lot has been, did we see any of the data being pulled from the states that did have more restrictive abortion policies put in place? And the answer is surprisingly no, we didn't. We really did anticipate that a lot of the data, or at least some of the data, was going to be pulled from the websites. And we did notice some changes in terms of how they were reported, but all of the data did remain accessible on the website, which is really, really cool. It's really awesome to see that all of these different states are still keeping that data publicly available on their state health departments' dashboards for abortion data. It's just really unexpected. So that was really cool.
All right, we got a great question from Angelica. Did you find that states report in clinic abortion versus medication abortion?
That was actually one of the categories we were hoping to report on. And some, not all states, but some states do tell us what type of abortion it was, whether it was like suction, whether it was medication. And they also, not all states, but some states also do tell us like whether abortions happened in state, out of state, in residence, out of residence. So we are planning to report that. Obviously, not all states report it, but for the states that do report it, yes, that will be reported.
Are you able to track complications from the abortion pill? The answer is yes and no. And Sarwat, please feel free to expand on this if I miss anything. But we have found that some of the states do report complications from procedures, but not necessarily specific to any abortion pills or anything like that. It depends on the facilities that were used and the procedures that the person underwent. So short answer, yes and no. I think it would be really cool if we were able to find some more data that's specific to all of the different types of procedures that are available. But right now it's not something that every single state reports on. And if they do report on it, not all of the counties have that information. And some of them report some procedures, some years, other procedures other years. So it's not always consistent across years, across counties, or across states. Thanks for the great question.
We had another good question come in. Will the data that we will be reporting, will it be always a year behind? So the way that this data will be reported, the abortion data is a historically available data set. We are personally choosing to start releasing the most recent year's worth of data. So in April, we plan on releasing all of the data that was available for 2021. Once we're done with that, we plan on releasing all of the data that was available for 2020. So the data that we will report will always be like old data, just because like historical data, just because 2022 data, like we're about a quarter way into 2023 and not every single state has even reported 2022 data. So we'll always be reporting historical data, but we'll be releasing the most recent years first so that the data that we are releasing has the most impact for anyone who wants to use it right away.
That's a really great question and very important for people that are interested in what's been going on this year in particular. It's common with publicly available data that are collected by different local entities. They take their time to process it and to make sure it's all there and to clean it and then release it to the public or in a report or in a PDF or in a dashboard on a little bit of a delay. So either 1 year, 1.5 years. I think that data cycle is speeding up with a lot of publicly available data sets.
Adding on to the train of amazing questions, we had another great question asked, which states did we find that are the best at recording data, which are the worst, and what are the most common stats that were reported? So we, in complete transparency, we have just begun reporting the data. So we're also currently still trying to hash through like all the data that is available out there. One thing we have noticed is that the states where abortions have the least restrictions do a pretty good job at reporting the data. They are pretty comprehensive in the data that they are reporting. The states that are the worst, unfortunately, we have a list of 7 states that don't publicly report their data. Like we've searched everywhere. We are planning on reaching out to those public health departments to see if they are able to provide this data to us. But I would say those are the worst states. They don't report anything, not even like state level totals. And then the most common stats that are reported are, most states actually do a pretty good job at reporting race and ethnicity data. I will say how they report race and ethnicity data varies, meaning like some states will report race and ethnicity data as like the categories that they will have available would be like white, Black, Asian, Native, Pacific Islanders, like a pretty diverse categorization of race. However, some other states will just have white and other. So that also varies a little bit, but the one that we've seen reported most consistently across all the states is race and ethnicity data.
Another common question we get asked is, how much does it cost to access the data? Hopefully you've heard by now that we're very into free and publicly available data. Not only is that what we tend to gather, but of course we want it to be in that format when we reshare it. in an aggregated form. So great question, and thank you for asking it.
To acknowledge the IVF part of the abortion data conversation about whether or not our data includes IVF related cases in terms of the data that we found and whether or not abortion bans will affect assisted reproduction. For the first part of the question, I have not seen really any IVF data in the abortion data that we've encountered so far. I don't know if that will be something that states might start looking at in the future just because of policy changes, but as of right now, we haven't seen anything. And then as for abortion bans affecting assisted reproduction, I can't say 100% as to what's going to happen or not going to happen, but I have seen people anecdotally being worried that IVF will be affected by abortion bans just because of policy and when the law specifically considers life to begin and how that might impact IVF.
We've got a great question. In the future, are there plans to work with organizations like the Guttmacher Institute to correlate the data you're collecting with the policies in those states? So I definitely want to give a shout out to the Guttmacher Institute because they collect policies. They've also been collecting data since 1970. They tend to aggregate it into the state level, and seeing the data behind the scenes in the different states, we totally understand why that is. So Guttmacher in their own right is a great data aggregator. They share their policies. They've got a great dashboard for exploring policies, and they've been really wonderful staying up to date on all the different changes. So we would absolutely love to work with the Guttmacher Institute. We have been in some contact with them. Those discussions are early. As you can see, we're sort of starting this outreach process now. So those discussions are in their early days. And if you know someone from the Guttmacher Institute and want to put in a nice plug for us, hey, Guttmacher Institute, we'd definitely love to work with you. So happy to collaborate. We think that's what it's all about, and happy to share what we have, hopefully vice versa. So thanks, great question.
There's a great question about ChatGPT and AI in the Q&A. Have we thought about using it for really anything? I think BroadStreet as a whole, we have thought about it before, just, in passing, what could we do to harness the power of AI? But in terms of the abortion data, when we were assembling the data way back at the beginning, back in the summer, I had been talking to it, so to speak, just bouncing ideas off of it on what you could potentially do with that data and how you might organize a data set when something is so different state to state and county to county. It can be really challenging to aggregate all of that data, as Sarwat talked about a little bit earlier in the presentation, obviously with a lot of differences between how things are reported, why they're reported, where they're reported, what's reported, literally everything about the reporting. I can make making a uniform, completely comprehensive data set really challenging. So I have just casually used ChatGPT just to, can I do anything with it? Is there a way to do that where AI can give me the answer without necessarily having to spend, days and days and days and days trying to figure out what might work. But other than that, we haven't done anything. I don't know if Tracy has anything to add about AI, but that's been my experience.
Yeah, so I think that when people are interested in data, it's not a stretch for technology interests to be close behind, especially because data itself is powering a lot of those technologies. Obviously, natural language processing is a little bit different than straight up data viz, but there's a few applications for AI. The first is actually, we're very thrilled that researchers are thinking about using some of our data from the Policy Data Initiative. We collected over 8,000 policies relating to COVID. Even before AI was in the news, we knew that there was utility in it being in a machine readable format. So we took all of those policies, and 160, way over 100 people over the course of 3 years collected all of those PDF policies and turned them into machine readable format for the purpose of possibly powering an AI exploration of those different policies relating to COVID. So 8,000 policies at the local, county, state, and city level, and the federal level as well. So we're hoping that some of our data will power some AI initiatives. And then as far as ChatGPT and other text writing formats, we're really big fans when we're doing data visualization of wireframing it out and pre-planning it and all the rest. I will say that if anyone's using bot-generated words, you definitely have to read them. But for really fast prototyping and saying, hey, I think this is what a data visualization could look like, definitely using AI to kind of fill that in so people can kind of get a sense of what that would do. So yes, we're using it where we can. Thank you for that great question. We've got some people that are interested in ChatGPT in the room here. Yeah, it's cool. It's very cool.